The majority of Zimbabwe's urban and rural local authorities have been facing a water crisis for a long time due to poor, dilapidated infrastructure and the impact of climate change. Most residents in urban areas have no household access to safe drinking water or adequate waste and wastewater disposal services. This has resulted in the outbreaks of waterborne diseases such as cholera and typhoid, among others. The advent of the novel coronavirus has posed another great risk to residents who do not have enough clean water to wash their hands in the absence of sanitizers.
Chinogona kupararira nokuti tinotomboungana zvekutomboungana saka tanchikumbira kuti vakatisira matepu tikurumidze tepu at least iya inokurumidza kuti tikakurumidza kuchera mvura tokurumidzawo kubva tichienda kudzimba tisaungana.
We have challenges in terms of water. Not that we do not have enough water, but the infrastructure that we have is now old and dilapidated. Some of the pipes are rotten down, so we then have challenges in getting water to the residents.
Kuma old suburbs tatine ine problem yemvura, sewer pipes edu, water water pipes edu esanga akaparara because ndiye kare ndiye kuma 70s.
We are failing to supply enough water to our people, and this has been the challenge. And number two, the infrastructure has outlived its time, and the replacement hasn't been done for the past years, 48 years ago. And we always have burst pipes here and there, thereby disrupting the smooth flow of water to our residents.
We would actually wish that if we could have bowls which would have at least safe water which can be tolerated.
Since the government of Zimbabwe declared the COVID-19 diseases as a public health emergency, various measures have been introduced to curtail the spread of the disease. Various stakeholders came on board and partnered the government of Zimbabwe in responding and mitigating the effects of the COVID-19 pandemic. DFID and ECHO through UNICEF empowered World Hunger Hilfe WHH with funding to respond and mitigate the effects of COVID-19 in Epworth, Chitungwiza, Stone Ridge in Harare, Gweru in the Midlands Province, and Chegutu in Mashonaland West Province. WHH also supported the call by adding its own funds through its headquarters.
The local board is our partner. Without them, we wouldn't be able to work here. And I think we see a very good partnership with them. And yeah, this is something which helps us a lot to have this good relationship with the board and work very good together and work on solutions in the first place. We identify the gaps and then we look for solutions. And this what we want to continue.
WHH is one of our main partners here in Epworth. They've been assisting us with hygiene promotion here in Epworth and also improving water and sanitation here in Epworth. They've been doing these things under the hardware part and the software part. Under the hardware part, they've managed to rehabilitate many boreholes here in Epworth that were not functioning. And also they've managed to upgrade some of our boreholes to piped water schemes so as to improve the provision of water to our residents.
I'm happy to say that World Hunger High Life came on board, and since then they've been assisting us very much in making sure that they bridge in the gap where we are failing as a local authority by drilling boreholes, solar boreholes. And this has assisted the city in a very big way. You know, we have got areas that are high-lying where, because of the aging equipment, we could not pump water to those high areas.
Most of the urban residents in Epworth, Gweru and Chegutu were fetching the precious liquid from open wells in the wetlands, while others were relying on a small number of community manual boreholes where they risk contracting the coronavirus due to overcrowding and diarrheal diseases due to the use of unsafe water sources. In some areas, private companies were cashing in on residents by supplying home deliveries with bulk water trucks. The availing of resources by DFID and ECHO through UNICEF to WHH has not only been vital for the prevention of COVID-19, but also a timely life-saving gesture for the residents of these areas.
Looking at Chegutu, it was regarded as one of the hotspots areas in terms of cholera munyika yese. So we are very happy nema interventions are kuitwa. Like this project, yakatisa another pipe water scheme that we are going to see, even drilling yama boreholes, even the software, hygiene messages and education. Shirikuti batsira is Chegutu district. My interventions are kuitwa. So we are very happy to appreciate basa rikuitwa ne WHH nema partners mamwe tukushanda nawo including the government.
Zvachinja pautsanana. Vanhu vachaita congested zvavaita. Paita vanhu vanoshandisa kuwanda vachiita tsvina pano, vamwe vanobva mumaplots ari around vachizochira nemadhongi. Saka paingocha kunge mochaira sei zvakasingaonekwi. Iye zvino zvaane order nekuti taane munyatsomungani miviri. Imwe munyatsoyo munyatsoyo vamwe vanhu vakuchera apa vamwe apa. Saka vavashoma kana vakauya vanenge vachita line vachigeza maoko avo. Andimaona pane magabi atinawo matini kutanga vageza maoko. Vaine mask zvakare vochera mvura yavo.
Kanzo yanga yane ma challenges ekutenga isingachakwanisi kuwana mari yekuita refurbish ma pipes neku water point kwedu from water treatment works. That was the main problem. Saka kuti mvura izobvoko ichiuya kuno kusvika kuno, this is the highest area. Saka tangatane challenge.
What we have also ensured in all our programming is to make sure that communities play a major role. And you also need to understand that when you are doing any programs, you need to make sure there is the active participation of the communities, because they are the ones that will who will benefit from all these interventions that you are doing. And their active participation will ensure that they understand the programs very well.
Dambudziko ranga riri hombi remanyoka revanhu vanongosamwa mvura yakanaka, munongoriziva dambudziko racho. Asi iko zvino kana zvimbuzi dzanga dzisingadihwi mvura yakawanda, asi iko zvino zvakudirwa mvura yakawanda nekuti yakawanda futi mvura pano.
Following a comprehensive borehole assessment in Epworth, Chitungwiza, Stone Ridge, Chegutu and Gweru, WHH identified boreholes that would suit rehabilitation and those that could further be developed into piped water schemes. This resulted in 15 schemes established in 4 districts: Chitungwiza, Epworth, Chegutu and Gweru. More than 20,000 people from 4,538 households have benefited from the completed disability-inclusive piped water schemes. WHH also supported with repairs of public toilets at public points such as bus termini and shopping centers in Chegutu, Gweru, Chitungwiza and Epworth. This has promoted safe disposal of human waste in these urban localities.
This ball is very bush bamboo. You save one, but you save one or shoma. That is the why you can upgrade. First, come up scheme around the ward, 7 points. So from 1 point, you have 7 points. In 7 points, actually, and get multiple outlets, my tips, and go on.
Kudhaya kwataita kwainetsa iye zvinezvi takuchera zviri easy, tiri kukasika plus mvura yedu yakachena.
The inclusiveness that we are talking about is to make sure that the design itself suits all age groups in nature. It also suits the elderly. It also suits people with disability, and we don't want to leave anyone behind.
Ndiri muvhenda hangu ndinoshanda ndichitengesa hangu airtime muno. Charity yakagara yakanaka, vanoibata zvakanaka. zvese tozvana zviripo ifini mvura ifini ukapinda mukati ndofunga mise zvinhu zvese zvakangomira zvakanaka.
The community health club concept is one approach used by World Hunger Health to involve and work with community members in addressing their WHH challenges in a participatory manner and fostering sustainability of all these interventions. This approach has seen a total of 53 community health clubs in Stone Ridge, Chitungwiza, Epworth, Chegutu and Gweru districts being trained and supported in COVID-19 awareness and infection prevention and control messaging. These community health clubs are also engaged in voluntary cleanup campaigns, door-to-door hygiene awareness, and income-generating projects such as making dishwashing liquid, petroleum jelly and artifacts from solid waste. Though these are emergency projects, however, WHH works with all partners and stakeholders from local authorities, the government and its extension field staff, the churches and school authorities, and the general population in the various project areas. This approach helps in fostering long-term functionality on all the infrastructure to be provided or upgraded by the project, hence leading to sustainability of these WHH services.
Tine vision yekuti Ward 4 as a whole kusvika muna 2025 imba yega yega inge yakuziwa kuchengetedza utano.
It's very interesting for me also to see the project, what's happening on the ground, and I'm very, very happy. Of course, there were issues already where we said, oh, maybe we need to change a few things, or where also the council needs to change a few things, but in principle I'm very, very happy.
They've assisted us with hygiene promotion in the community through street hailing. We've been utilizing the community health clubs that they've trained before to disseminate information in the community. Then they've also assisted us to beef up the community health clubs that are on the ground by training 4 more community health clubs in Epworth.
We are grateful to WHH for the help that they are giving us, and we want to make sure that we have as many boreholes as possible so that people can access clean water.